listening is the key word, I think for sure. A lot of us in advocacy, particularly policy advocacy, like to talk a lot and we have a lot of ideas and opinions and maybe some of us were in debate club and you want to go into a debate and win it. But I think really sitting back and hearing what it is that someone is telling you about what their concerns are. But even before you get to the listening part, there's this connection that needs to be made. And I always think of a long time a mentor of mine who just passed away in the last couple of years, Judy Schneider, who was with the Congressional Research Service. She taught all of the members of Congress how to be members of Congress. She was a real stickler for policies and procedures. But her biggest thing that we always used to talk about is cocktail talk. She used to say, if you can't have cocktail talk with somebody, it doesn't, a member of Congress, a staffer, someone in the administration, and really hear what they're saying to you, you're not going to get anything done.
Welcome to Chief Influencer. I'm your host, Anthony Schaub, co-founder of Social Driver. Washington is the center of influence in the US and arguably the world. We are featuring leaders who figured out how to break through in today's fragmented and noisy world. Social Driver teamed up with the Communications Board and the George Washington University College of Professional Studies to recognize these leaders as chief influencers and highlight how they inspire and influence others. I am thrilled to introduce today's guest, Kathryn Schubert, or Katie as I know her, who's the president and CEO of the Society for Women's Health Research, the thought leader in advancing women's health through science, policy, and education. Before we dive in, here are three things that I think you should know about today's guest. Number one, Katie is a trusted leader and consensus builder among women's health stakeholders. Under her leadership, the U.S. government made an unprecedented investment in women's health research, and she is a go-to source for media on this topic, and we will hear more about that soon. Number two, Katie is really an advocate at heart. She began her career on Capitol Hill, and then she advised organizations on policy strategy in the healthcare space. Prior to her current role, she served as chief advocacy officer at the Society for Maternal Fetal Medicine. And number three, beyond her role as president and CEO, Katie is a well-regarded board leader in the health advocacy space. She's a board member of the National Health Council, the Maternal Mental Health Leadership Alliance, and ASPN Foundation. She's also past president of Women in Government Relations, past chair of the board of the Maternal Mental Health Leadership Alliance, former board member of the Coalition for Health Funding, and we could go on. Katie, you have been called many things, from Professional Women in Advocacy's Advocate of the Year to one of Washingtonian Magazine's most influential people shaping policy and healthcare, as well as spin instructor, and of course, chief executive. Well, today we are thrilled to call you Chief Influencer. Welcome.
Thanks so much for having me. You make it sound so good. What a kind introduction.
It's easy to make you sound good. You do so much incredible work, and you've been recognized, which I always love seeing people doing great work, getting that recognition. And there's a lot for us to talk about today. I wanted to just start, I really am interested in this advocacy approach of leadership. And, in 2020, you were named Advocate of the Year by Professional Women in Advocacy. And that was for your work on inclusion of pregnant and lactating populations in research. I wonder if you could tell us, how do you influence policymakers and the medical community to make sure that research doesn't exclude half of the population? I mean, that seems like a basic thing, and yet we're learning it's been a major issue.
Yeah, I mean, it does seem like that's something that you would assume to be the case, right? That any medication that you take or any, treatment or trial that you would go through to better your health would have been tested in someone who looks like you, who is your age, your race, your ethnicity, et cetera, lives in an area like you. And that's just not true. So I think that's one thing where even before I got to the Society for Women's Health Research and before I was at the Society for Maternal Fetal Medicine, I thought that was the case. So I think all of the advocacy starts with education, really making it clear that for us, right, women were not included in clinical research until 1993. that pregnant and lactating populations, we're still fighting that battle. That was something that back in 2013, I was pregnant with my third child and had been asking my doctor and others about what I could take to treat a sinus infection. It was a really easy thing. It was not a chronic condition. And I got, three different answers about what I could and could not take. And so I asked my client, the Society for Maternal Fetal Medicine, what the deal is. And they said, well, that population is excluded from clinical trials. So we just do the best that we can. And that really led to this conversation surrounding what are the policy solutions we could come to make sure that that population is included. And so we're really proud of that work. I'm really personally proud of that work. And it continues today to make sure that we're just thinking about it, right? It's just being considered, and where it is safe, we're able to do it. Where we can use modeling, we can. But that's sort of the last part of the population of women who have been excluded actively from clinical trials, and we're doing our best to make sure we can change that.
Maybe you can dive in a little bit more on that, Katie, because when you share that, like your personal experience of not, getting a great answer, you want to make sure if you're taking something for sinus infection, it's not going to impact your health or your unborn child's health, right? And at the same time, I can imagine there are reasons why certain populations might not be included in clinical trials because it could be risky to them, right? And it could be difficult. So how do you approach that? I know that part of what your organization does is help policymakers navigate that to not just throw up their hands, but to say, actually, there's some things we can do here.
Yeah, and I think this was really part of the reason that we were created as a society, was that even researchers inside of the National Institutes of Health didn't realize that women were being actively excluded from clinical trials. The thought was that women are just little men and that you could just extrapolate the data out. And it sounds so funny now, 35 years later to say that, but that really was the thinking. That we could just figure out what was going on based on the information that we had. And we obviously know that's not true now. But it was a huge hurdle. And I think, the intent behind excluding women was really a safety issue. The thought was that, if someone were to become pregnant in a clinical trial and you don't know the consequences or the risk to the fetus or the woman, it's better to not do that research. And there are many different phases of research that you get to before you get to the human side of clinical research. And so really taking the experts to the federal agencies, to Congress, to be able to say, there are ways that we can do this safely. And in fact, it's actually unethical to not include these populations, so that we can better treat, prevent disease, all of these things that make us healthy and well, and make sure we actually have a really good idea of what that clear path forward is for treatment. So it really starts, again, with education, data, and then the personal storytelling of people who
Yeah.
have been impacted. We hear this a lot in the autoimmune population in particular, women of childbearing age who aren't sure whether they can start a family or not, and maybe make a decision that they're not going to have a family based on just thinking that they can't stay on the medications that they've been on for a very long time. And that may or may not be true, but the reality is we need the data, and then we can make the case for the policy solution.
Yeah, absolutely. I know your organization has been, working on this for a long time. You mentioned over 30 years, and obviously progress has been made, but it's still a big issue. And last year, there was some media coverage around this. The National Academies of Sciences, Engineering, and Medicine reported that for decades, the U.S. National Institutes of Health has failed to prioritize and fund research on women's health. And you were widely quoted in media around that. And so this is a problem that folks are aware of, but that hasn't been solved. And I wonder if you could talk a little bit about the size of the problem. And particularly, there are a lot of different priorities in the world and a lot of priorities specifically around health. And I wonder if you could talk a little bit about how you address that in your communication with different stakeholders to make sure they understand that this is worth prioritizing and that there is still a major challenge here.
Yeah, I mean, one of the ways that we really think about this issue is, again, starting with education. So, pointing out that it wasn't until 1993 that the NIH was required to include women in clinical trials, that wasn't that long ago. That often gets a gasp in an audience when I speak on this topic. But the reality is also that it wasn't until 2016, which is less than a decade ago, that female mice even had to be included in consideration in research. And so that one always gets a big pause, I think, from people, because you would think at the very least, maybe we would look at animal models, or
Yeah.
even at the cellular level, we'd think maybe there's differences between males and females. And so sort of starting at that point where we're level setting that there is such thing as what we call a gender health gap or a women's health gap, that we are sicker than ever before. There's more chronic disease. We're experiencing high maternal mortality rates. And then when you dig deeper into women's health in particular, when we look at something like maternal mortality, if you're a Black woman, you're 3 times as likely to die of a pregnancy related complication as a white woman. And that's regardless of socioeconomic status. So there are things going on here that need to be investigated. The answer is, we don't know why, and we need to use research to figure that out. But if you look at sort of women's health across the lifespan, regardless of disease state or condition, if you're in an issue that predominantly, or uniquely, I should say, impacts women, like endometriosis or maternal health or menopause, you're probably sicker or have been in pain for a longer amount of time, have been misdiagnosed often. I think endometriosis takes up to 7 years to diagnose.
Right.
There's no good way to do that. And it affects about the same proportion of women as diabetes. And we all know what diabetes is, and we know how to treat it. So really just thinking about the true impact there. So there's sort of that issue, but there's also this issue of women's health being, quite frankly, all health. We can better target therapies and disease pathology if we actually do look at sex differences. If we look at males versus females, we see this in heart disease, number one killer of women and men. And actually, we're at the time of this recording, closing out American Heart Month. We were just on the Hill yesterday talking about the fact that women often present in the emergency department in active heart attack, and it's not identified,
Right.
because the guidelines that were written were based in men, and heart attack symptoms are very different in women than in men. And so, that's an example of where we know what the science and the research tells us, but it hasn't necessarily been implemented in the way that we would like, most broadly. But we see it in brain health, Alzheimer's disease. 67% of Alzheimer's patients are women. It could be because we live longer. It could have something to do with the X chromosome. We really need to dig deeper into that.
Mhm.
I mentioned autoimmune conditions. 80% of autoimmune patients are women. Again, we don't know why, but we need the research to do it. So this women's health gap is very prevalent across the board.
Yeah.
And it's 51% of the population. It's not, a small proportion. And the last thing I would say too is sort of how we think about influencing the conversation. It's not just the health and well-being of, 51% of the population. It's also the role that women play in broader society. So we often serve as caregivers, whether that's for children or aging parents, friends, family members, etc. But we're also known as chief medical officers of our
Ooh,
family. So
right.
we're making a lot of decisions for other people and controlling a lot of the market in healthcare, but we still have this health gap amongst ourselves that needs to be addressed.
Absolutely. Well, you make a very compelling case for the importance of women's health research. Obviously, that's what your organization is focused on, and one that I think has really, a broad appeal. The way you described it, for policymakers, medical community, anybody. I know a lot of your work is done in partnership with other groups, and I wonder, how do you position your organization um, to engage with other partners so that they see you as a great organization that they want to be part of, you know, the same efforts? Because it occurs to me that the way you brand yourself to policymakers, or just, the story that you tell, there might be a bit of a different way that you tell that story to customize that message to say, hey, we are a partner that you should work with. And again, I know you've done that really successfully, and you've been a part of a lot of other, groups on their board. So can you say a little bit about that?
Yeah, I mean, I think we're a very small organization compared to a lot of other organizations based in DC. We have 10 full-time employees. We have a lot of materials for a small team. And so we wouldn't be able to do anything without partnership and in coalition with other organizations. We also don't claim to be the expert in particular disease states or life stages. We are very broad, and that places us, I think, a little bit differently. So when it comes to sort of broad women's health research, funding levels, things like that, we're able to that's really where our expertise lies.
Mm,
When we're working in coalition, which is in every other area that we work in, right? When we're talking about heart disease, as I mentioned, or other areas, we're really working to be inclusive, to have the organizations who are experts. In that case, we look to American Heart Association and Women Heart, and others to really come in with their expertise, and we amplify their voices.
yeah,
We are able to leverage their experts, their researchers, patient voices to fill a gap with our materials that maybe hasn't been done before. One thing we're really careful about is, we do not want to be duplicative in anything when we're educating patients. We're really looking to them to tell us, what is it that you need? I mean, that's how we came up with a toolkit for teens on endometriosis. We had our experts come together, lots of different endometriosis groups, and they said, we don't have this. It would be great to have it. So really identifying that gap and making sure that everybody's voice is represented, at the table, and making sure that we're there to amplify and come along with them, but also bring them along with us, depending on the conversation.
yeah. It's so important to know, when do you lead, when do you follow, when do you walk alongside. And I think that can sometimes be, a challenge, because sometimes there might be reasons an organization wants to play a leadership role when somebody else is already doing it. So I think the way you talk about working with those partners and dividing it up is really interesting. I wonder if you could talk about, we go back to the topic of advocacy. I know you lead in advocacy organizations, and you've served in the leadership of many others as a board member. But how do you show up as an advocate yourself?
Yeah. So there's a lot of different ways I think advocacy plays a role in life. One way is internally with staff, advocating for the team, whether that's in their professional development or having their backs, that's really important, I think, internally. It's also important externally, especially when we are working in a coalition, or we often have, in women's health, there's not a lot of evidence behind a lot of this. There's sort of knowledge that we all have, but often there are conflicting thoughts on sort of a direction that a particular material should go in, right? Is advocating for where our expert team sees the need, and things like that. Obviously, there is a huge need, and it's growing. And I think more people than ever before fully understand how to call your member of Congress, how
Mhm.
to call, the White House operator now. People who have never done that before are doing that. And so I think understanding the intersection between the role that legislators can play in your real life and what that means, whether that's through, Medicare coverage or, your education system or whatever that might be, whatever the thing is that's important to you. But I think the one thing that I really, and maybe this was surprising to me a little bit, is in seeing it with my children and really being an advocate for and with them. So showing them how to advocate for themselves, whether that's in their healthcare, or in school, which often comes up, right? No, you have to go to your
Mhm.
teacher and you have to find out what it is that you're missing. But to really be able to give them the skills and the tools that they need to be able to succeed later on. There's always something that you can do to be an advocate. It's just a matter of fully understanding sort of what those avenues are,
Good.
whether that's in life or professionally, or in the
Mhm.
world even.
Having a career in advocacy around policy advocacy in particular, I wonder, what are some of those skills and tools that you have developed that you see across your career have really helped you break through and get that message across to the right people?
Yeah, this has been a lot of people ask this question about, okay, how do I do this? And I asked that question too when I was starting out my career, right? Like, what's the thing I have to do to win, or to make my case that this thing, their policy that I'm asking for, is the right way to go? And I was always dissatisfied with the answer because it felt like it was really nebulous. The answer and the true answer is it's relationship building, it's trust building, and it's understanding when you think that you've either lost or you're losing ground, that there's a way to stay in the conversation so that when the pendulum swings back the other way, you'll be ready to take advantage of that opportunity. But I really think at the end of the day, it's all about, are you connecting with people individually? Do you genuinely care about them, and the work that they're doing? And coming to the realization that I think we all, no matter what side you're on of any issue, we all want a good solution. And we just might disagree on sort of what that policy solution is. But there's probably a way to get to either a middle ground, give a little, and then maybe you'll get a little, which always felt to me when I was early in my career as kind of, honestly, I thought it was like a dumb answer because I'm like, no, no, no. If you have the right policy solution, people are just going to know that that's the right thing to do and they'll just do the right thing. But the reality is they have different perspectives on it. And so you just have to fully understand where they're coming from to be able to address the questions and the concerns that are very real and valid that they might have. And then, try your best to get to a place that makes sense, even if it's incremental. A lot of change does
Yeah.
not happen overnight.
What are some of the ways you found that you can get people to share their point of view with you and to effectively listen? I just, because, I know you probably meet with people who are all across the spectrum in terms of their experiences and their points of view. And it's not necessarily easy to do that, in a way that you build that connection. So I'd love to hear your kind of tips on listening.
Yeah. Well, so listening is the key word, I think for sure. A lot of us in advocacy, particularly policy advocacy, like to talk a lot, and we have a lot of ideas and opinions, and maybe some of us were in debate club, and you want to go into a debate and win it. But I think really sitting back and hearing what it is that someone is telling you about what their concerns are, but even before you get to the listening part, there's this connection that needs to be made. And I always think of a long time a mentor of mine, who just passed away in the last couple of years, Judy Schneider, who was with the Congressional Research Service. She taught all of the members of Congress how to be members of Congress. She was a real stickler for policies and procedures. But her biggest thing that we always used to talk about is cocktail talk. She used to say, if you can't have cocktail talk with somebody, it doesn't, a member of Congress, a staffer, or someone in the administration, and really hear what they're saying to you, you're not going to get anything done. Do you know a member has a dog and you know that dog's name and you just ask how they're doing and genuinely ask how they're doing, right? I
Yeah.
went into a Hill meeting yesterday and met with a staffer I had met once before. I remembered that they particularly liked to garden. And I was just like, oh, I remember that you were gardening. I saw you in the fall. What is your plan for this year? Also, I would like some tips on that. So I was interested in the answer. But I think it sort of level sets you to a little bit more of a comfortable place. You're not kind of running into an office and starting with your arguments. You're making that connection, then you listen. Then you
And
think about it, right? You don't need to solve something right away, but you have to really be able to respond to whatever it is that they're telling you.
this episode is brought to you by the George Washington University's College of Professional Studies. With in-person and online programs ranging from master's degrees in public relations strategy to certificate programs in digital communications, GW offers more than just the credentials to help working professionals get ahead. It prepares them to be leaders in their field. I'm a proud GW graduate myself, and I can attest that the faculty members combine academic rigor with real-world lessons that can't always be found in textbooks. Check out cps.gwu.edu for more information. Yeah, that human connection, right, makes such a difference when it comes to influence. And I know you served on and chaired a number of boards. And I wonder if you could talk about that, how that role may be different and what leadership lessons you've learned in board leadership roles managing people who aren't your employees, right? You're just a group of volunteers, and you happen to be either one of their peers, or you may be, in your case, chairing the board. But I suspect that that human connection piece is important, and maybe you can say more about that. But in general, I'd love to hear any other leadership lessons you've learned because you've had so much board service.
Yeah, I do have a lot of board service, and I feel like some of it was I sort of fell into it a little bit. When I was at a lobbying firm, I wrote a business plan. I didn't know how to write a business plan. I was told, "Write a business plan," and part of my business plan was to join Women in Government Relations, and then, it so happened that there was a board seat, and I really like to get involved. I have a case of the getting involved in a variety of areas of my life. But I think that as I saw, sort of the opportunities to learn how to lead through board service and give back to an organization that was really instrumental in my own career. I firmly believe I would not have been able to get to a CEO role if I didn't have that board service, if I
Mm.
didn't learn how an association is run, what a board thinks about, what is the role of a board. And then as chair of a board, it gets tricky too because you do have a lot of personalities. And I think that really thinking about consensus building, reaching out to people and connecting with them, making sure everyone feels heard. I think that was a really big lesson for me. Sometimes people sit back and they listen and they don't say a lot, and then you'll leave a meeting and they have a lot of thoughts on the direction they think something should go in, but maybe they didn't share it in the meeting because they didn't feel comfortable. And so really making sure that you're creating a safe space, a good conversation, and allowing for dissenting opinions, which
Uh,
is hard to hear, particularly if it's somebody who hates an idea that you have, but it's really important to have that. I mean, that's, I think, been a huge lesson for me is really watching for those who are the quietest to see, okay, what's happening? What is it that you're thinking about? And quite frankly, being an extrovert myself, I often, just assumed that people would just come out and say whatever it was that they're thinking, and that's not true either. So big lesson there.
Say more about that because I think that's a very important point, what you just said.
Yeah. So I think for me, and I've done a lot of reading on, extroverts versus introverts and sort of where we get our energy from. And I get a lot of energy from interacting with people and being on. I do have a limit, but for the most part, that social interaction is really important. Many people do not have that, and they are drained, from those interactions and feeling on all the time, and so, really having an understanding of how others prefer to operate, excuse me, how they prefer to communicate even, that's a huge conversation even internally here at the society. Okay, I know where my profile is, on the disc, and then we look at everybody else's to really understand, where they're coming from. For instance, I know certain people like to really sit back and think about it, and they're not gonna respond right away. I have a gut reaction to things, and I'm gonna share it immediately, and I have actually had to learn to step back in that, because in this role as CEO, you really have to think about, "Okay, everything that I say, people take as this is the way that it's going to be." But in my
Yes.
mind, it's just, "Oh, I'm just sharing my thoughts and, we'll figure it out and we'll work through it." But they're not taking it that way. So I think that's been a big piece of my learning experience and through board service for sure. I never, as either a board chair or a board member or even a CEO, I have to really hold myself back a little bit because there are ideas that are way better than mine, but they may not be heard because I've already come out and said, I think we should do XYZ. And I'm just throwing it out there and waiting for somebody to tell me why that's not a good idea, but they may not feel comfortable doing that.
Yeah, I'm so glad you talked about that because I think remembering that people have different styles and it's not always doesn't always mirror what we do. I've had the opportunity to serve on some boards myself, and one of the pieces of advice I got a long time ago that I think kind of shifted the way I try to show up in those environments was that, boards tend to plan a lot of the agenda out. And so just sort of throwing out ideas, and I love coming up with ideas, but just throwing out ideas in a board meeting, even if it's a great idea, it might be kind of disruptive to what that board meeting is there to accomplish. So, write those things down and send them afterward. And I found that when I have the discipline to do that and just make my list of my ideas during the meeting, and then I send it to the chair or the executive director afterward, they tend to be much better received. And then, sometimes it's like, oh, that's a great idea. Yeah, we're actually already doing that. Or sometimes it's we hadn't thought about that. That's great. Thank you. And so I had to sort of retrain myself because I think in other environments, sometimes it's sort of like if you don't say it, then it'll be gone and there's no other chance. But actually, sending it afterward can be very effective and remembering that other people in the room, like you said, may not verbalize their ideas in that way and asking them, and inviting them to participate. So I can see why you've had so much success serving on many boards and being elected as leader of several because you're sort of exhibited that emotional intelligence that not everybody shows up the way that you show up, and that creating that space for everyone can be much more powerful, and you can tap into the energy of that group. It sounds like.
Yeah, it's hard getting there though. I mean, I feel like you have to have a lot of self-awareness and self-reflection. And that was a lesson learned in a variety of ways, but I had a boss who was the complete opposite of me in terms of the way that he wanted to interact. And I'd go into our one-on-one meetings without an agenda and just chatting with all these ideas. And I felt really frustrated that I wasn't getting a guidance or I wasn't getting what I needed. And I was talking with an executive coach and I said, I can't do these meetings. These meetings, I don't get anything out of it. And she said, I think you're overwhelming him. I think you need an agenda. You have to go, you have to stick to the agenda. If there's things not on it, you can add it to another agenda and really make sure that it's more structured. I'm sort of the big thinker pioneer, and we'll figure out the details. It doesn't matter what the details are now.
Sure.
And I think many people are, no, tell me the details and how you're going to get there. And so I often have to like take a minute and pause and fully understand that, oh, we're not speaking the same language. And that's okay. We shouldn't be.
Yeah.
But it took a while to get there, I think, to really sit back and reflect on that because it's hard to be like, oh, this isn't really the right way to go about it.
Well, and thank you for sharing that lesson that of how you learned it because sometimes you hear this great advice and it can seem like the leader just was born with knowing these things or just manifested it, and hearing oh you learned it through experience, and that's how we often do learn things, and you applied it, and we can take those lessons from you and maybe even skip that step if we're lucky if we learn from your experience. So thank you for sharing
Yeah.
that. I want to talk a little bit about um, social media, if we can switch gears,
Sure.
because I had the opportunity to moderate a panel recently at the National Health Council's Health Leadership Conference. And you were on that panel alongside Chuck Henderson from the American Diabetes Association and Steve Taylor from the Arthritis Foundation, three incredible chief influencers, each of who has embraced that role and leveraged their personal brand on social media, such as LinkedIn, to support their business goals and their professional aims. And so I wonder if you could talk a little bit about your approach to using social media as a leader.
Yeah. Well, and this was something that also took a little bit. And I will say, Anthony, your talk on how to use LinkedIn and showing and sharing how others are using it was super, super helpful because LinkedIn in particular was intimidating to me. I wasn't sure how to use it. I had it. I didn't really do a lot on it. I was much more of like Facebook was the really big thing when I was my kids were young, and so it was like a place to share photos of my babies and I don't know, make weird updates about what I was doing that day or whatever. And then was really using Instagram similarly to interact with folks. But as I came over to the society, realizing that personal brand, particularly as a CEO, was really important, and being recognized as a thought leader or an expert to go to, that people are watching these spaces. And so I had taken sort of a challenge from the National Health Council meeting 2 years ago to see if I could really be more intentional with my LinkedIn and build connections in women's health, um, get to a broader audience, and also just engage both staff and external sources in women's health. So I did that. In fact, I think I put it into my goals for the year for like my professional
Oh, that's
development
great.
goals was to do better at LinkedIn. I would have to think about what those metrics were, but I would say being invited to sit on that panel was probably really good because and as I said, be careful what you wish for, because
Yeah.
now people are asking what you do. But I think sort of a combination of like, how are you recognizing your team? A lot of sort of tagging people who've worked really hard on something so that they get recognized for it as they're building their own brands, and their own expertise. That's really important. But I think for me on the advocacy side, particularly in the last year, we've had a lot of momentum at the federal level, as you mentioned, with women's health research and funding, and it's now become a national conversation. We're reaching people through LinkedIn that we would never have been able to either reach or engage with otherwise. And so
Yeah.
we've been really intentional in thinking about the posts that we're putting up, how we're engaging there, and showing up authentically. For me personally, like, I was a little nervous because I thought of social media as something that you use for personal use, but I saw Chuck using it that way, and Steve, and even, like Leah Howard at the National Psoriasis Foundation will often post about her children, or something exciting that's happening in her personal life. And so I started to do a little bit of that. And then I had a really what I thought was a crazy week. I was in LA and I was meeting really famous people and speaking to them about women's health. And that was really cool and exciting. And I came back to DC and we were doing big policy meetings. And so I was like, I'm going to make a video about this week. And I didn't know how to do that on LinkedIn, but I did know how to do it on Instagram. So I made it on Instagram and then I just cross posted it on LinkedIn. And that video got a lot of views and engagement, and people were really excited to see it.
Yeah.
And so I have started to just do a little bit more on the video content side and really talk about what it is that we're doing. It just goes a lot further than where our, channels might have gone otherwise.
Yeah, you absolutely have embraced that role of chief influencer and using your Instagram account, your LinkedIn account as a way to connect. And we've, learned some sort of what we call pillars of being a chief influencer. And I mean, you really touched on every single one just in the comments that you made. They are things like start in the center and build those champions on the inside before you worry about building them on the outside. And you talked about that with your audience. You talked about authenticity. We like to say embrace the gray. We don't have a separate personal and professional brand like we may be used to. There's this overlap, this gray area, and you have to embrace that. And you did that through the video that you mentioned, which was great. And also just the way you show up and tell stories, that authentic connection. Um, we like to say share the stage with others. And you mentioned tagging other people and highlighting your advocates, highlighting your team, making it about them. A lot of leaders say, well, I don't want to just self promote all the time. Well, great. You don't have to actually. This is a great place for you to shine a light on other people and share the stage with them. And you do that so well. And then the fourth is we believe it's important to learn the lingo of a platform and, just how to tag people on LinkedIn and, the fact that content versus a link back to another website is going to do better. And you did a cool hack that I've told other people about. Create that video, that vertical video on Reels, and then post it excuse me, LinkedIn from Instagram because LinkedIn prioritizes vertical video now. And so the fact that you found a cool way to get that yourself, you didn't have to hire somebody to do it for you, and it performed very well on LinkedIn and it showcased authenticity. And then the last thing is we often say, go for growth. And that means your own personal growth. Don't let yourself get overwhelmed by the FOMO of seeing what everybody else is doing that you don't have time to do. Just think about what are my goals and what is one step I can take toward my goal. And I think you mentioned that you set this as one of your goals. You're trying to use the platform to reach people that you couldn't reach otherwise. You're innovating in ways that you do it. So I don't know if you did that on purpose or not, Katie, but you literally in just a minute described each of those five pillars of a chief influencer. And I think they're things that any leader or any communicator can learn from. And so I hope folks who aren't already that they go to LinkedIn and they look up Kathryn Schubert, Katie Schubert, and they follow you or connect with you if they already know you, so that they can see exactly what you're doing, because you're really, I think, a role model for how other leaders and how other advocates can use a platform like that to advance their goals.
Oh my gosh, thank you. I wish I could say it was intentional, right? Some of it was. But I do think it's a learning process. I think that's the other thing. It's so scary because you're putting yourself out there
Yeah.
publicly. And the biggest thing is like, oh, what if I say something stupid? Or
Yeah.
what if I post something that my family is not excited about, or whatever it may be. And so, but I think, you start small and you get
Yeah.
there. And, I do worry about oversharing sometimes on the personal side, but people will get over that, I guess.
Yeah. Well, and I want to ask one just final question on this topic, which is ROI. Another CEO may be listening. I know that there are other CEOs listening right now, and they might say, okay, I know I probably should do that, but I just don't have time. I don't have, the energy. I don't know how to do this. Is there ROI to this? How do you know that there is ROI, that you can spend the time that you spend using a platform like LinkedIn?
Yeah, there's a couple of ways that we know that it's working. One is just the growth of my connections and the number of followers that we have, both for my personal LinkedIn page, but also our organizational LinkedIn page. That's grown, over the last year or two when we've been thinking about what to post and how to post. I do also think it doesn't, as you said, right? Like it doesn't have to be a post that you sit there and try to write about the really important things that you're working on and you want to get the language right. It could be it could be comments. Like that was huge, is just commenting on other people's posts, which takes
Yeah.
2 minutes. It does not take long. If you're already scrolling through Instagram in the morning or your emails, it's the same amount of time. So we know that it's working based on just the interactions we've seen. But I will also say I often see people in person and they comment on how much we are doing and what we are doing and how we're doing it. Both me personally, but also the team and the organization. And I think that's one really important thing. We didn't get, people didn't make a point to comment on that before. And so the biggest thing I've learned is that people won't know what you're doing unless you tell them about it. And that can feel a little bit weird sometimes because it does feel it's self-serving. But this is important work, and you want to make sure that it's getting out to not just your current audiences, but many others who maybe didn't know that this was an area of concern that they needed to worry about.
Absolutely. If you believe in your mission, then you say, "Of course, I want more people to know about my mission," and then you center what you're doing around that, as you've done so well.
Yeah, it's been great.
So I have to ask you one last question, Katie, as we wrap up today. I know you're a spin instructor, and I have this vision of someone on a spin bike, uh, pedaling, but not going anywhere, feeling like, "Oh my gosh, I'm just in one place." And I know this is how a lot of advocates feel, and sometimes how a lot of leaders feel is, they're working so hard, but it could take a really long time to see results. And I just wonder if you could share, what keeps you going? What inspires you when you're in those moments where it can feel like, you're not going anywhere, or even that you're going backwards on some of the things that you care about?
Yeah. Well, and it's funny, I will often, when I am teaching a spin class, I'll make a joke about being on a bike to nowhere, which never goes over well for people who are just trying to get their workout in.
Yeah.
Um, but I do think in advocacy and policy, it often feels that way. It often feels like nothing's getting done, or you're just hitting roadblocks time and time again. And we were just talking about this as a team as well. We have been really lucky as an organization over the last few years to see such huge successes. But that's not necessarily the norm. It took years to get women included in clinical trials, and we still have this women's health gap. And in
Mhm.
policy in particular, you will maybe take a step forward and then you might take a few steps back. And
Yeah.
so the biggest thing for me is it may feel that you're spinning your wheels or you're not getting anything done until something happens or there's an opportunity that presents itself that then you just have to be ready at all times. There is a difference though between sort of that keeping the hope alive for something to get done and just understanding, well, like maybe this isn't the right approach, or maybe a win looks different than it would have in the past. We are also talking a lot about that. What are the things that we really truly care about, that we need to make sure we maintain? Whether that's through a congressional transition or administration transition, these are all normal processes here in DC. And so there are times when we get to go and have flashy wins. But we exist as an organization and as advocates for the times when it's not like that, so that
Yeah.
we keep fighting for what it is that we need and we keep showing up. And yes, that can be frustrating. I think there's a lot to be said for taking a breath, doing your meditation or your spin or running a half marathon or whatever it is that you need to do to stay centered. But it's just really in thinking about, okay, what's the point we're trying to get to? And is this making a difference? Even when it does feel like you're maybe not making as much progress, but this can often happen like in such small steps and that's more common than not. And just keeping that in your head is really critical to staying in the game, if you will, right? Because it can be really frustrating and you could want to leave. But then when you think back, like we are celebrating our 35th anniversary, look at the progress we've made, right? Look at these wonderful things that we have to celebrate and what we have accomplished. And now let's identify the things that we really need to focus in on to move the needle even further in this space.
Absolutely. Focusing on that vision, as you sort of shared, and just knowing what you're fighting for and why you have to move forward, and even if it's a little step at a time. But I love what you just said, because I think all leaders can really benefit from this. As you know, like in your case, 35 years, that do take a moment to look backwards and say, hey, we've accomplished a lot. And, so driven people often are just so focused on where they want to go. It feels like they're standing in place. But when they look back, they realize, oh, all those little steps added up to something. And I think that that's a really good analogy for us to think about not only the progress that your current organization has made around women's health research, but also just the advocacy in your career with all the wonderful organizations that you work with, whether it's the National Health Council or others. So I find that very motivational, and I will remember that the next time I'm on a bike to nowhere. Katie, thank you so much for being with us today to share your story about the important work that you do, about lessons that I think all of us can learn, whether we do advocacy and policy or whether we're just being an advocate for ourselves or others. That role of an advocate is so important. And then I really appreciate you sharing more about how you show up on social media and how that was something you had to be intentional about and you had to focus on and say, I'm going to make this a goal and take steps. And, now look, you're posting these cool vertical videos and you're getting all this great engagement and you're seeing ROI, most important of all. And I think there's so many great lessons for folks from this interview today. So I just want to say thank you so much for sharing your story.
Thank you. Thanks for having me.
Chief Influencer is a production of Social Driver. We help clients transform complexity into clarity with people-centered strategies. Whether you're looking to elevate the influence of your brand or your leaders, check out socialdriver.com to learn more. For show notes or to nominate a guest, visit us at chiefinfluencer.org or follow Chief Influencer on LinkedIn.